In this video, I'm going to explain the mandibular joint, its type, and the structure that are forming it, and also the related questions in the MRCS exam. We've explained before the temporal bone, and that is formed of a squamous part and three processes. You can see the process here. This one is a zygomatic process. This is a styloid process, and this is a mastoid process. We also mentioned that it has a fossa here that is called the mandibular fossa, and this is where the head of the mandible is going to articulate to form the mandibular joint. On this photo you can see that the head of the mandible is number 1, and this is the articulating part of the mandibular joint. Of course 2 is the condyloid process. So the mandibular joint is a synovial hinge joint, which is formed by articulation between the head of the mandible on one side and the mandibular fossa and the articular tubercle on the other side. The joint is supported by multiple ligaments, which we are going to demonstrate on this diagram. Starting by the structures that's forming the joint, we can start from here. Number 8 is the head of the mandible. Number 7 is the articular tubercle. And number 6 is the articular disc. Number 5 is the mandibular fossa. So as you can see, the articulation is between the mandibular fossa, articular tubercle on one side, and the head of the mandible on the other side. There is a disc in between, which is called the articular disc, and that separates the joint space into two potential spaces, as you can see, one superior and one inferior. Might be even more clear on this diagram. You can see this is the head of the mandible, mandibular fossa, articular tubercle, and this is the articular disc to form a synovial hinge joint. To add some more ligaments that might be related to the mandibular joint, you can see 3 ligaments here. Starting by number 2 is a lateral temporomandicular ligament. 3 is a sphenomandibular ligament between the sphenoid bone and the mandible. And 4 is a stylomandibular ligament, of course, between the styloid process and the mandible as well. This will leave us with 1, which is the joint capsule. The exam questions might be related to 1, the movement of the mandibular joint, 2, the type of the mandibular joint, and also the structures forming the mandibular joint. We talked about the structures, that it's the mandibular fossa, articular tubercle, and the disc in between, and the head of the mandible below. Type, it's a synovial hinge joint. The movement of the mandible can include protraction, retraction, side-to-side movement, and the gliding movement, and opening and closing as well. You can see 6 different types of movement. You might also be asked about the muscles causing these movements, which is explained before in multiple videos and will